Hi, I'm Paris, and earlier this year I got some test results that absolutely shocked me. Not related to my prostate cancer, which I was diagnosed with almost 4 years ago now. Not related to the cancer at all, but possibly related to the cancer treatments. So here's a brief recap of how I got to those test results. Again, I was diagnosed with prostate cancer 4 years ago, but about a year and a half before that was having some heart issues with palpitations, with PVCs, premature ventricular contractions, things that make you go like that because you feel your heart flipping over and doing weird stuff. So I was going and seeing a cardiologist about that. At that point, I was pretty unhealthy. I weighed about 250 pounds for being 6'1". My blood sugar numbers, I was pre-diabetic. Cholesterol, triglycerides weren't terrible, but were really not very good. I was on statins for the cholesterol. I was on blood pressure medication. I was on beta blocker to help with the arrhythmias. And my doctor sent me for a calcium scan of the heart where they can see where you have the plaques that have calcified. And wasn't a very good score. My cardiologist told me I had the coronary arteries of someone more than 10 years older than myself at that point in my late 50s. And finally, I listened to what my primary care doctor had been telling me for a couple years at that point as my prediabetes got worse, as my cholesterol got worse. She recommended this book, said, "Why don't you try this? Prevent and Reverse Heart Disease." My cardiologist did not recommend the book. He said basically this is how it goes. As you get older, your arteries clog up. My primary care doctor, a nurse practitioner, was more open-minded about what can be done if you're willing to make the lifestyle changes. So I went through this book again, but this time I took it all to heart. I followed all of the things in here. I cut out the fats, cut out the animal products, tried to get more active. I improved sleep, other lifestyle things, and the weight started coming off. The palpitations got to be less and less till I hardly had episodes of them anymore. I was no longer pre-diabetic. I no longer had high blood pressure. I got to go off my medications over the course of about a year, year and a half. It was great. And then I got the cancer diagnosis. And so you might say, well, you sure you did all this stuff, but then it gave you cancer? Well, of course not. The cancer was brewing for many years, possibly decades. So as I mentioned, chemo, radiation, 3 years of no testosterone, no estrogen. And we get to earlier this year when I went to see my primary care doctor and ordered all the usual tests. And she said, hey, you know, it was 5 years ago you did that calcium scan of the heart. It's recommended to do that every 5 years, so I'm going to send you for that. And I thought, well, that's good. This will be a chance to show that this stuff really works in an objective, numbers of the scan kind of way. I didn't really expect my numbers would get better because I understood that when it's all calcified, that stuff's probably not going to go away. But I thought, well, it should be pretty close to how it was. And I'm 5 years older, so at least I'm catching up in age to the age of my arteries. But then I got the email saying you have new test results. And when I opened up and saw this, I nearly fainted. I could not believe it. How is it possible with all the changes I made, all the improvements in my health? Admittedly, I've been dealing with cancer and cancer treatments for 3 of the past 5 years, but how could my numbers have gotten so bad so fast? I went from mild to moderate coronary artery disease, the kind where they say, we're going to keep an eye on it, to severe, where they don't say, but you imagine they're thinking, you're a heart attack waiting to happen. So something had to be causing this. Did my A1C, my blood sugar, get out of control and I didn't realize it? My cholesterol numbers, the LDL, the triglycerides. I opened the page of my blood test results and saw this. So of course I immediately contacted my doctor and said, I need an appointment. And how did this happen? Look at these numbers. I don't see there's anything that could have caused my coronary calcium score to do this in the course of 5 years. I now, physically, not counting the cancer, I'm probably the healthiest I've been in more than 30 years. What's going on? I asked 4 different doctors this very question. 2 of them told me, well, you're older. This is just naturally how it goes. The arteries clog up. I don't buy that. plenty of places in the world where people eat the right foods and avoid the things that damage the arteries, and they live to be in their 90s and their arteries are slick as a whistle clean. I knew my arteries were not going to go back to being that clean, but there's no reason why they should have clogged up more. Well, from what I could see, so two of the doctors, they were no help. They just said, well, that's how it goes. So, take more of this, other medications. So two other doctors, though, they said, okay, your cholesterol has been pretty low. So people with the higher cholesterol tend to accumulate that in the coronary arteries where there's damage. The cholesterol collects in there. So you don't have a lot of cholesterol. Maybe you have a lot of damage. Maybe there's something that's been causing problems with your endothelial lining. In other words, I've got injuries happening inside my blood vessels. Well, what could that be? Both of those two doctors said the same thing: inflammation. They said you might not have a lot of cholesterol causing problems, but if you have a lot of inflammation, whatever cholesterol you have is getting in there and causing these kinds of issues. So if I've had this inflammation in the arteries, what's triggering it? What's causing it? And they said, well, look at your life for the past few years. Chemo, lots of damage throughout your body. Radiation. I'm currently going to hyperbaric oxygen therapy to try to resolve issues with radiation proctitis, bleeding in the rectum, and the lack of testosterone, lack of estrogen. Estrogen is very cardioprotective. From what I've read, this is why women tend to have their heart attacks 10 to 15 years later than men, because of the cardioprotective nature of estrogen. Men have estrogen too. In men, the body converts some of the testosterone into estrogen. I had no testosterone for 3 years, therefore I had no estrogen, therefore I had no cardioprotectiveness going on, and part of this could be attributed to that. So that was the opinion of those two doctors. Made a lot of sense to me. Cover all my bases. I continue to research, podcast, YouTube videos, reading lots of stuff online. I read about another type of cholesterol that they don't usually test for, Lp(a), that a certain percent of the population will have high numbers of that, and that can cause this kind of damage even if your LDL numbers are lower. So I went on my own and got an Lp(a) blood test done, and those numbers showed, no, looks like I'm in the good range. I heard podcasts by people on the keto side of things, because you got the vegan side and you got the keto side, and these people, of course, don't like each other. I threw my lot in 5 years ago with the whole food, plant-based, high-carb, vegan folks, which the keto folks say that's the unhealthy way to live. And since I saw these results, I listened to some of the speakers for the keto movement, even though deep down I really thought, no, I'm on the right path over here, but I'm going to listen to what they have to say. And they said, no, you're doing those carbs. The carbs are reducing your insulin sensitivity, and so that can damage your cardiovascular system. And I'm thinking, have I been doing it all wrong? Should I have been eating meat all this time and not vegetables? But no, this book got me through my heart episodes 5 years ago. I'm sticking with this, but maybe there's something to what the keto people are saying, that my blood sugar is not great. It's under 100, but it's in the upper 90s. My A1C, I think on my last test, about 5.3, so I'm not pre-diabetic, but I hear the podcasts and all saying, oh, even in the 5s, that's bad. You got to get that A1C down into the 4s. You got to get your fasting glucose down into the 80s. Okay, I'm willing to try anything, but I've cut out so many foods. I started way back, even before my 5 years ago episode. I was trying to cut out the salty foods and cut back on the meats, especially red meats. And then I cut out the sugars when I got up to being pre-diabetic. And then I cut out the rest of the dairy and basically went vegan. So I'm cutting out the meats and the high protein things. And now I've got to cut out the carbs. There's not a whole lot left to eat. I am the best patient a doctor could hope to have. I am 100% compliant. I will do exactly what you tell me. But you got to tell me what to do. Delving deep into all these things, trying to figure out how best to take care of my heart, it's driving me a little crazy. So I got this news back in February, and I'm not exactly over it now, but I've come to accept it. I would certainly like to stop those numbers from getting any worse. I wish I knew how to do that. It seems like just doing what I've been doing may not be the right thing, may not be enough. Maybe now that I've got my testosterone back, that'll be the magic sauce. I have made some changes to try to improve even more my blood glucose and insulin sensitivity. I've cut out eating dates. That was my treat. That was my treat in life, was eating dates. And I ate dates that earlier period when I lost the 50 pounds. I was having dates every day. That got me down to just under 200 pounds. But it seems like if I want to have these truly excellent blood sugar numbers, I'm probably going to have to get my weight down. Right now I'm 195, probably down to like 175 or so. Cut out the dates. Those were my treats. I've cut out, I'm in the process of cutting out the last of anything bread related. I've eaten the Ezekiel bread. I really liked their cinnamon raisin one, but I knew I'd eat that a little bit too much. So cut that out, and I'm down to my last variety of that, actually my last loaf. And when I finish that, I'm going to try to stay away from any ground up, whether it's grains or even beans or lentils, anything that's ground. I'm going to eat everything whole so I don't spike the blood sugar. This summer, they're coming out with the continuous glucose monitors, like the Dexcom, the little thing you stick on the back of the arm, and then you put your phone near it and it tells you your blood sugar and it monitors it all the time. Hypochondriac me will be one of the first people to get one of those as soon as they're available to the public, since you don't need a prescription. And I will be watching everything I eat and seeing what it's doing to my blood sugar, and I will improve my numbers even more, because maybe that's the key. It couldn't hurt, but I do have to tell you, giving up dates, that really did hurt. And I'll see you on the next review.
There are so many choices and you don't want to stress. You want your health food at home, receiving only the best. That's what we're here for, we give honest reviews. Paris DX.